welcome to our alumni and guests online. We would like to welcome you to the AADC, the Associate Alumnae of Douglas College Smart Talk Lunch and Learn presentation, the A, B, C, and Ds of Medicare. I am proud this afternoon to present to you Rhonda Peters Titus, Douglas alumna, class of 1979. Rhonda began her career in the insurance and financial services field at Horizon Blue Cross Blue Shield of New Jersey in the individual and group health insurance arena. While at Horizon, she participated in varying aspects of the marketplace, including a heavy concentration in the small group health area and the senior health care market. After a successful career, Rhonda left Horizon Blue Cross to start the Peters Financial Group Incorporated. The Peters Financial Group specializes in employee health benefits, life and health insurance. I'm sorry, let me say that again.
That's okay.
The Peters Financial Group specializes in employee health and life and health insurance. The Peters Financial Group also helps individuals solve their insurance needs. Rhonda is licensed in the states of New Jersey, New York, Delaware, Maryland, and Pennsylvania. Please help me this afternoon welcome our fellow alumna, Rhonda Peters Titus.
Thank you. Thank you. It's nice to see friendly faces. Some I know for a long time, others I'm meeting today for the first time. We're calling this the A, B's, C's, and D's of Medicare because for those of you who are Medicare knowledgeable, you know that Medicare has Parts A, Part B, Part C, and Part D. So let's get into it. Medicare Entitlement Part A. Most people get Part A coverage, which is generally referred to as hospital coverage, without having paid a premium, because it is either because they either work 10 years or 40 quarters, their spouse worked 10 years or 40 quarters, and they paid Medicare taxes while working. For people who do not automatically qualify for Part A, the monthly premium can be up to $422 per month, depending upon the duration of the Medicare covered employment. For people who are getting benefits from Social Security or the railroad retirement, they will automatically get Part A and Part B when they turn 65, and you can refuse Part B under certain circumstances. But know that, and I'll get into this a little later on, that refusing Part B when you're eligible could result in a penalty. For people with disabilities who are under the age of 65, they are automatically enrolled in Parts A and B if they receive Social Security, disability, or railroad retirement for 24 months. Once again, you can refuse Part B, and people with ALS or Lou Gehrig's disease automatically get Parts A and B when their Social Security disability begins. People with end-stage renal disease or kidney failure can sign up for Medicare at any time, but Medicare usually begins 4 months after dialysis treatments begin. In both instances, people with those particular conditions should contact Medicare and be in contact with them because that's something that is out of the norm, and Medicare can and Social Security can walk you through. If you're not getting benefits from Social Security or the railroad retirement, you can sign up for Parts A and B during what's called your initial enrollment period. And that initial enrollment period usually begins 3 days before you turn 65, the month in which you turn 65, and 3 months after. And you qualify for Medicare the first of the month in which you turn 65. If your birthday is on May 1st, you qualify April 1st. So that's the only little tricky thing in there. For people who don't enroll in Part B when they are first eligible, there is a general open enrollment period each year from January 1st to March 1st, and coverage would begin on July 1st. And once again, if you don't have a special circumstance, I get into the penalty. There can be a penalty attached. If you have group health coverage or coverage through a spouse, You may enroll in Part B anytime while covered under that plan, and that's a special enrollment period. At the current time, and this is critical, COBRA is not considered the same, let me repeat that again, is not considered the same as regular coverage under a group plan. So it is important to double check with Medicare as to the timing of things and when things should be done. I'll give you an example. And this is something that a lot of human resources people and personnel people don't know. You and your husband are the same age and you turn 65 in the same year. You are covered, or he is covered under your benefits, and you turn 65 in February, and now you're deciding, you know what? I'm done, we're done, we're gonna go off and travel the world, but my husband doesn't turn 65 until October. So we're gonna hold out. I'll take COBRA and I'll wait until we both turn 65, then we'll go on Medicare. No. COBRA benefits are not considered creditable under Medicare, especially for Part D, which is drug. So you, as the employee, would be charged a penalty because you're outside of your guaranteed issue period, which is the 3 months before you turn 65, the month in which you turn 65, and the 3 months after. But your husband would be fine because he's going to enroll in October and everything's hunky-dory with him. So that's critical. So just know that COBRA is something you think twice about if you're approaching 65 or your husband is and the other one isn't turning 65. You could end up with a penalty because of that. That's critical, and you'd be surprised at the number of people that don't know and the number of human resources professionals don't know. It's like in the old days, Sharon and I were talking about being enrolled at Douglas at the same time, Animal House and double secret probation. This is what I call a double secret thing, that Social Security and Medicare, they know it, it's there, they just don't advertise it at all.
So in that situation, would it be better for the wife to work to October?
In that situation, and I'll say I'll hold questions till the end, but in that particular situation, the wife can enroll in Medicare, and the husband can stay on COBRA or take an individual policy, okay? Because the husband does have options, but this is where talking to an agent or somebody who knows can be advantageous to you. And, not even all agents know. So talk to somebody who's really well-versed in senior benefits. You must enroll in Parts A and B if you are not collecting Social Security and want coverage, or if you are not actively working for a large company. I say large company because Social Security defines large company as any employer with 20 or more employees. So if you're working for me and I have 2 employees, you would enroll in Parts A and B, Medicare would become primary, you have to get a supplement. If you're working for, as Sharon said earlier, she recently retired from DuPont, you would keep your Part A, and when you retired, if you were over 65, then you can enroll in Part B with no penalty. And I'll get into that a little later on as well. The initial enrollment period is when you are first eligible for Medicare, and as I said earlier, it is usually around your 65th birthday. There is also an annual election period, which people often refer to as open enrollment, and for those of us who are in the know, you start seeing the commercials come up in September and October. Open enrollment starts October 15th and ends December 7th. And that is for everybody across the board. Then you can change your drug plan, or if you're in a Medicare Advantage or Part C plan, you can change that for a January 1st effective date of the following year. However, if you wish to change your Medicare supplement from one supplement to another, or go from an Advantage plan to a supplement, you may be subject to medical underwriting because you are outside your guaranteed issue period. Major medical entitlement and Part B. And I'm going to hand this out. I'm going to ask Egypt or whoever, somebody, help me. Thank you. There are 5 income brackets for Part B. In 2019, the standard monthly premium begins at $135.50 per month and then can increase depending on what your modified adjusted gross income is. People ask, how do they know? Social Security goes to the IRS, they do a 2-year look back. So for 2019, they look at your income taxes for 2017 to determine if you have to pay an income-related adjusted amount. If you are collecting Social Security, your Part B premium can be taken out of your Social Security check each month, or if you are actively working and not collecting Social Security, you can pay that quarterly, the government does bill you. If you do not enroll in Part B when initially eligible, you may be subject to a late enrollment penalty if you are not covered under a large group plan. Once again, you have certain periods of time to do this. 3 months before you turn 65, the month in which you turn 65, 3 months after. If you do not enroll in Part B when eligible, that Part B premium is increased 10% for each 12-month period that you did not enroll. But there can be help out there for incomes with limited and low income, so you should contact the state Medicaid board for that. Don't sit down, I'm keeping you busy.
Thank you.
Part A, and the reason why I'm handing these out in dribs and drabs is I have rather have you focus in on me, what you need, rather than to get all caught up in the paperwork out there. Part A benefits. Part A covers your medically necessary hospital. It has a $1,364 deductible for 2019. Those deductibles do change. They usually increase every year. And that is for a hospital stay for up to 60 days. After 60 days, there is a $341 per day copay. So you see that Medicare, it does cover some things, it's not 100% of anything. And after 90 days, God forbid if you're still in the hospital, there is a $682 a day copay. There are also lifetime reserve days of up to 60 days. After 150 days, Medicare stops paying for inpatient hospital stays. Medicare also helps cover blood, hospice care, home health care, some skilled nursing and rehab care, and Medicare will cover this, the rehab care, after an initial 3-day hospital stay. They also cover inpatient psychiatric care up to 190 days per lifetime. And most critical, Medicare does not cover custodial or long-term care. People think that it's the same thing. No, it's not. My father required custodial and long-term care. He needed help bathing and dressing. He needed somebody to cook for him. That's custodial long-term care. That you have to buy a separate policy for, called a long-term care policy. But it, you know, and I've had friends that have been in rehab for extended periods of time. And once again, they had a long-term care policy to pick up what Medicare did not cover. Excuse me, as I'm doing a lot of talking, I'm going to grab it quick. And allergy season is also trying to kill me, ladies. Yeah. Part B. Part B covers your medically necessary doctor or home health care services, outpatient hospital, outpatient lab, diagnostic services, therapies, mental health therapies, and other items. People pay a deductible of $185 a year in 2019 and can pay a 20% co-insurance. So this is what's confusing to every single person I talk to. Part B has a monthly premium attached to it of $135.50. It also has, excuse me, see what I mean with the voice? A $185 for 2019 deductible. And I'll be referring to this. When you enroll in Medicare, you get the infamous Medicare and You handbook, and you see I've marked my Rhonda's copy, because I don't get this, I have to call up and ask for this every year. But, well, I'm not on Medicare. I used to use my father's when he was alive, but it's the Bible. This is unique to every state they print it. This is for New Jersey. And any questions, even if I have questions, if somebody asks me, this is the first place I look, because I always want to make sure that I give the right information.
How do you get the book?
You can call 1-800-Medicare and ask them to send one to you.
Thank you.
Medicare does pay for some preventive services. They pay for a one-time, welcome to Medicare, welcome to Medicare. Forgot to visit that. And they will pay for an annual wellness visit every 12 months that you are enrolled in Part B. And once again, there is a schedule of when Medicare will pay for certain immunizations and other screenings, and this is where you go, Medicare and you, to find out. Part B also covers, and here's some additional, ambulatory surgical centers, blood, rehab under limited situations, and certain, like they will not cover indefinite rehab. Diabetic supplies, certain durable medical equipment, emergency room visits, eyeglasses after cataract surgery, diabetics, foot exams, treatment of feet, and for diabetics, hearing and balance exams, but not hearing aids. You know, they cover the testing, but not the hearing. And hearing aids, from what I understand, are not cheap, so.
They're not.
Home health care in certain situations. When my father, after he was hospitalized, he had to come home and somebody had to come and change his dressing. They came every day, they changed the dressing, they made sure that was okay, then they left. They didn't give him any custodial care. They changed the dressing, they checked the wound to make sure that infection hadn't set in. That's home health care. They will pay for that. They will not pay for it, which is why he was staying with me, cooking and cleaning and everything else, yeah. Kidney dialysis and certain situations in mental outpatient. Limits on occupational therapy and physical therapy. Prosthetic and orthotic devices, COPD, second surgical opinions. COPD is chronic obstructive pulmonary disease. Speech language pathology, telehealth, tests, x-rays, CAT scans, PET scans, MRIs, and transplant services. So Part B of Medicare is very comprehensive, and what it covers, it just doesn't cover 100%. And so you could be liable if you don't have a supplement or something else to pick it up. There are many services not covered by Medicare. Acupuncture, dental, cosmetic services, custodial care, hearing aids, special shoes or routine foot care, routine eye exams. People often ask me, well, what happens if I get pink eye? Pink eye is an illness, that's a sickness. Any plan covers an illness, but just to go, like, I don't really have eye issues. I have to go and get my eyes checked and put on my glasses so I can see you ladies clearly. That's not covered. They will cover some screenings. They will cover syringes for and insulin for diabetics, but not syringes for people who just want syringes. You know, you have let me be more specific about that. Let's say you have to take some sort of infusion shot every day. That is medically necessary. They will cover the medicine, but maybe not the syringe. Okay. They will cover, also they will not cover syringes unless you use it with an insulin pump. The insulin would be covered under the Part D or drug benefit. See, it gets a little squirrely in there. And outpatient drugs are covered under your Part D benefit. Inpatient infusion, most of the time, it can be covered under your Part B. You know, I'm thinking like when you go for chemo and that kind of a situation, that's Part B. Outpatient drugs are covered under your Part D or drug. And for more information, here we go back to, and I know I'm referring this now.
Yep.
Medicare and You Handbook. Now, you may ask, okay, now that I know what Medicare doesn't cover, and I could be out of pocket for a lot, how do I get that coverage? And you get that coverage from either a Medicare Supplement or a Medigap plan or a Medicare Advantage or replacement plan. Those plans are plans that are sold by private companies that are filling in the gap of what Medicare won't pay and your out-of-pocket expenses. Medigaps or Medicare Supplement plans will help pay for a portion or all of Parts A and B, your coinsurance, deductibles, co-pays, anything that Medicare deems necessary. Most of the time, the supplements will pick up 100% of those, but it can depend on what supplement you have. There are choices. And some supplements will even cover illness if you're traveling outside of the country and you get sick. They won't cover routine services, but let's say you are in France and you have a fever and you're sick and you want to go see a doctor. Depending on what kind of a supplement plan or Medicare Advantage plan you have, that could be covered. The Medicare Supplement plans are standardized plans and identified as with certain letters like A and N and F and G. And not all plans are sold in every state. So you really do have to be careful about, what you're buying. Somebody called me up and offered me a plan that's $100 a month, and I'm thinking, in New Jersey. I don't think so. And it wasn't an insurance plan, it was a discount plan. So really, don't get involved on the phone with anybody when discussing Medicare. Each state has its own specifics about who can do what, why, when, where, and how. And I say that because if you are under 65 and qualified for Medicare, there is only one plan in the state of New Jersey, one supplement plan that you are eligible for. That's it, it's one plan. In California, you may be eligible for all of them. In New Jersey, it's a little different. So you really have to speak to somebody who knows, and I've had this happen to me with, clients that are now, thank God, you steered me in the right direction. The good thing about the Medicare Supplement plans, A, B, C, F, G, high deductible F and N, are that the benefits are standardized. The Center for Medicaid and Medicare Services says, fine, if you're going to sell these plans, these are the benefits. So whether you're Horizon Blue Cross, whether you're the behemoth, AARP, whether you're Aetna, whether you're Cigna, you have to have all the same benefits. Once again, turning 65 and signing up for Part B triggers that Medigap open enrollment period where the plans must be issued regardless of pre-existing conditions, and that's called the guaranteed issue. So I often say to people, and I've had a few clients who've been very ill at 65, and they go, but I want this plan, I'm afraid for medical underwriting. I said, because you were in your guaranteed issue period, you have 2.5 feet in the grave. They have to take you. No questions asked. Outside of that guaranteed issue, you could be medically underwritten and they can refuse you. So know this. Individuals that enroll in Medigap plans only have to buy a separate Part D or drug plan. It is highly recommended that your drug plan must be purchased to avoid any penalty, especially if medications are needed. And I say this once again, let's get back to Animal House. I say it's like voluntary mandatory. You don't have to sign up for Part D, but if you don't, you are penalized for it. And people will say, well, I'm really not taking any drugs now, so I'll find you an $11 a month plan if I have to. But if you get to a point in your life when all of a sudden something does happen and you are taking a lot of drugs, you don't want to have to pay a lot of money for drugs plus a penalty because you did not enroll in Part D when you were initially eligible. Medicare will make changes to Medigap plans effective 2020. This is something that is critical. Individuals newly eligible for Medicare after January 1st, 2020 will no longer be allowed to join Plan C and Plan F. Those plans cover the Part B deductible. CMS, the Center for Medicare Services, has said the Part B deductible can no longer be covered by Medigap plans. If you have Plan C or F, you can keep that plan for as long as you continue to pay the premium. However, for someone like me who's eligible, I think in 2022, I'm not sure, I would not be able to get that plan. Medigap plans or supplement plans will pay only after Medicare has paid, and once again, will only pay for items that Medicare has determined that are medically necessary. So the doctor may have recommended that you get acupuncture, but Medicare is not going to pay for it. Like my doctor said, your core, you got to work on your core. I want you to go to yoga 3 times a week. Yes, I hate yoga. And it's not being, people will try to ram it. Well, the doctors say a lot of things too, but no, Medicare is not going to pay for that. Part D, here we go. We're ready now. Part D. And this is the tricky one. I tell people, forget what you know about your current employer-sponsored drug plan. Forget it, throw it out the window. When you enroll in Medicare and you take Part D, that does not exist anymore. Wow, yeah, well, there you go. Part D plans. Now, Medicare has, or the Center for Medicare and Medicaid Services has come up with what they call the standard Part D coverage, and this is for 2019. This does change every year. And I like this handout because it is colorized and it helps you, and I show this to my clients. If I was sitting across from you one-on-one, I would show you this exact same handout because it helps people understand exactly what's going on with Medicare. The standard Part D deductible is $415. So before you touch anything for drugs, you know that you're out of pocket $415. Your initial coverage period is 25% of the cost of your drugs until you reach a total out of pocket of $3,280. And that out of pocket is between you and the insurance company. It's not just all out of pocket for you. If you look at the example. In the coverage gap or donut hole, and some people refer to it as the donut hole, the member pays 37% of the cost of the generic drugs and 25% the cost of the brand name drugs. The drug manufacturers have provided a 70% discount on brand name drugs. Until between what you paid out of pocket, what they call the true out of pocket cost of $5,100 or true. And then you're in what's called the catastrophic coverage period. And you're going to pay the greater of 5% for $3.35 for generic drugs, or 5% and $8.35 for all other brand name drugs. The Bipartisan Act of 2018 moved up the date for closing the donut hole for brand name drugs to next year. So, for 2018 and every year after, the beneficiary cost sharing for brand name drugs after the initial coverage limit is 25%. In 2020, the beneficiary cost for generic drugs will also be 25%. It's critical to know this, and you see how different, if you're covered under an employer-sponsored plan is, you're used to going in, paying your copay, and walking out. This is very different. Now, I say this is standard because when you do enroll in a Part D plan, most of the insurance companies have what they call a tiered structure for your drugs tier 1, 2, 3, 4, and 5, preferred generic, generic, preferred brand, non-preferred brand, and then your specialty drugs. Usually with your tier 1 and tier 2, your preferred generics and your generics, there can be either a $0 or no dollar copay for those drugs. Some Part D carriers also have no deductible for your generics and preferred generics. And for a lot of the Part D carriers, they've reduced the deductible for your tier 3, 4, and 5 specialty drugs. That is something that when you're sitting with your agent or you're talking on the phone to somebody, and hopefully you're sitting with an agent because they're showing you exactly what it is, they can show you how your drugs are covered. What we do as agents is, and I do this for my clients all the time, I say, okay, Marjorie, send me a list of your drugs, what you're taking, and the quantities. And I go in and I look them up, and then there's a search engine that I use, and it spits out what for Part D carrier will give Marjorie the best bang for her buck. And that's part of the reasons why I say use an agent, because not all carriers for Part D are created equal. You have to look for, sometimes the Part D carriers will have preferred pharmacies. ShopRite, CVS, Walgreens, those preferred pharmacies you may go to, you may have no copay for your drug. So that's really important. Then you also include mail orders. So if you're on a maintenance drug, they may try to get you to use the mail order, they set you up and it comes automatically and everything is fabulous. And once again, not all Part D carriers are created equally. Each Part D or drug company is required to have at least 2 preferred generics and 2 brand name drugs in each category on their formulary. Each carrier has a different formulary. So this is why it's critical that you either go into the search engine yourself or sit with somebody who can do it for you, because they will look up the drugs and say, wait a minute, I know that you really like United because you're with them now, but Humana actually is a better carrier for you because all but one of your drugs is a preferred generic. And that could be critical. If it's a preferred generic, you could be making a $1 copay for those drugs. So that's really important. As I said, the cost of having a drug plan varies by plan and varies by carrier. There is a penalty for not joining a plan. And if you do not have creditable coverage, and creditable means as good as what Medicare offers, and this is where that COBRA thing came in. COBRA is not considered creditable coverage for Part D. Then you could have a penalty. And so when you have the penalty is given to you and you pay the penalty. I used to say forever, and people would look at me very nicely and they'd not quite get it, and I'd say, you pay it till you die. Then you say, oh, okay, I've got it now, right. You know, forever until you die, I just don't get it, but yeah. You must join a plan within 63 continuous days following your initial enrollment period, and once again, or pay that 1% of the national average of the premium for each month you did not have Part D forever. In most instances, it is and can be more cost effective to enroll, once again, I said, the very low cost option to avoid both the penalty and have a plan in place in case if you do have to take medicines as needed. Most plans do have a step therapy and prior authorization, and your doctors are really good at this. Step therapy. I have a client who has MS, and she's taking a very high-end drug. Well, her company didn't want to cover it anymore. She's not Medicare eligible. I'm just giving an example of what step therapy is. And so they pushed her back to a generic, and then they stepped her up to the next one, and they stepped her up to the next one, and they put her back on the really expensive one again. But they do that in order to make sure that the most expensive drug is the most effective, or can we use a cheaper drug and still get the same result? Part D does not cover plans for weight loss or weight gain, fertility, drugs for cosmetic purposes, drugs for relief in cough and cold, drugs acquired outside the United States, vitamins, non-FDA approved medicines, erectile dysfunction drugs, some off-label drugs, and drugs covered under the Part B portion of Medicare. Part D does not cover. If you find that you might have problems paying for your drugs, you can always contact the state Medicaid office. New Jersey has several plans in place. PAAD, Pharmaceutical Assistance for the Aged and Disabled, that they give help for low-income people to help them pay for their drugs. So there is help out there. Part C, or Medicare HMOs. And you see a lot of advertising for the Part C plans. There are the Medicare Complete plans. There are Medicare Advantage plans. They have the advantage of having all of your benefits included, your Part A, your Part D, and in some plans, your Part D. They can have low or no premium, but they can have deductibles and copays. They are Medicare HMOs, and I say that again because people come to me all the time and say, you know, I have Aetna, I love Aetna, I'm covered in Aetna now, I want to keep Aetna, and I say, wait a minute, different network of doctors. It is a specific network of Medicare doctors that a company has that you have to use the doctors in that network. You can have copays attached to it. You do have to select usually you have to select a personal care physician. There may be referrals required. And you will have to make copays. There may be also copays and deductibles. There are definitely deductibles associated and copays associated with the hospital and certain lab tests. So just be careful. Premiums can be anywhere from $0 a month to $40 or $50 or $70 a month. They can have low costs attached to them, but you may end up paying more on the back end for your hospital and lab tests. So just be aware of it. Once you are in a Medicare Advantage plan, you do have opportunity to switch out and be covered by a supplement, but you may be subject to medical underwriting. Once again, that happens during the open enrollment period of October 15th through December 7th. So you can switch in and out of Medicare Advantage plans. You can go into one during open enrollment. They don't ask any medical questions. However, if you want to come out of one, and I have had clients come out of Medicare Advantage plans, you do have to be healthy. I know, right? And but no, the interesting thing about that is you sit and you think, well, most of the time they ask you, have you had a hospital admission in the past 2 years? What was that hospital admission for? They're not looking for you had a cold or maybe you broke your arm. They're looking for something major in there. And I happened to a client of mine, I've had every scenario under the sun. And I said, I really wouldn't do this, but he wanted to do it. And lo and behold, he ended up in the hospital and wanted to go back to a supplement. And I said, I don't think you're gonna have to wait a couple of years now and hopefully no hospital admissions, So I said, they serve a purpose for people. Don't get me wrong, but you have to really look at the big picture all the way around. You just can't look at the bottom line and say, but it's only $75 a month. Yeah, but look at what you're paying here. HMOs do have a limit on your out-of-pocket costs. And usually for this year, I should say not usually, but for this year so far, your max out-of-pocket cost is $6,750, but it can be lower. You may need to select a PCP or get a referral for specialty care. They also can offer additional benefits like dental and hearing aids and so forth and so on. There can also be PPO plans, so you can have coverage in and out of network, but know that if you go out of network, it will be subject to a deductible and co-insurance. There can also be what they call special needs plans or state-based plans. Those are your dual coverage plans. Someone may have Medicare and Medicaid. In this instance, a dual option or what they call DSNP, dual special needs plan, may be right for them. People that have chronic conditions, COPD, heart failure, the Medicare Advantage plans have whole areas of chronic illness providers, nurses, doctors that work with people to help people manage their illnesses. Most of the Medicare Advantage plans include a Part D or drug plan. If your plan does include a Part D or drug plan, you must use that plan to get your Part D benefits. There are Medicare Advantage plans that do not have a drug benefit attached. Those plans are good for veterans who may get their benefits to the VA, or, for example, I have a client who worked for a major drug company, and her retirement package, which I wish I worked for this drug company, she pays $45 every 3 months for, I know, right, for her prescription drugs. In that instance, she can enroll in a Medicare Advantage plan with no drug benefit. If you try to enroll in a Medicare Advantage plan that doesn't have a drug plan and then a separate drug, you'll be kicked out. You can't do that. So and that's something that if you're calling up somebody on the phone or you're sitting with your agent, the agent will tell you. Once again, I want to thank you. That's the end of my time here. I want to thank the AADC for allowing me to come and my friends for coming. And do I have any questions?
Well, first of all, thank you.
Thank you.
Okay.
Tell me your name.
Oh, Denise.
Denise, okay.
How do you get started?
Oh.
Oh boy. Never married, no kids, no hang-ups, no drama.
Okay, that's a fabulous
But
question.
this is like overwhelming.
It
And I
is.
am knocking on the door.
I'm gonna ask you ladies just to pass these out. I'm handing out something that says, and it's great because it takes you 6 months out if you're turning 65, what to do, the various steps. I always tell people, of course, what do? You call me, I'll help you. But it is very daunting, and there is a little research that you have to do, and does your company cover you? Are you gonna be actively working after you turn 65? Are you gonna retire? Children, no children, doesn't make a difference. You qualify for Medicare individually based on your date of birth and your year of birth, so 1954 is the year. Anybody born in 1954 is turning 65 this year.
Yep.
How do you apply for Medicare? Well, once again, and thank you to Egypt and all her help, I'm handing out something else, how to apply for Medicare online. Because you can apply for Medicare online, you don't have to go to Social Security, which can be an adventure in itself, mind you. Yes, give me your name.
Bertha,
Bertha, yes.
what do you recommend for people to do who, when they retire, their company has no medical benefits?
They have no medical at all?
Mm-hmm.
Then, how old are they?
Well, when they get ready to retire.
Okay, 65.
Right.
Then, all right, if your company does not offer any medical benefits at all, and I'm gonna sit now, ladies and gentlemen. If your company does not offer then you would have to go on Medicare if you're 65. And you would enroll in Parts A and B, and then you call me, and I help you figure out what's the best situation for you. Yes, name?
My name is Michelle Josias.
Hi, Michelle.
Hi. In a situation where you have folks who are on Medicare Advantage and they move to a different state, Florida, how do you go about that?
Oh, then great question. The question was, if you have somebody that's on a Medicare Advantage plan and they move from New Jersey to Florida, what do you do then? What you do is they qualify for what's called a special enrollment period because they've left this service area. So they, once they do that, they move to Florida, they would contact some plans in Florida. Now this is for Medicare Advantage only. And Part D, possibly for Part D. And then that they have 63 days to enroll in a new plan. And that because they're moved out of state, that's a special enrollment period, they would be able to change to a different Medicare Advantage carrier. If they're in a national company like Aetna, United, they may be able to easily transition from Aetna in New Jersey, United in New Jersey, Medicare Advantage to United, Aetna in Florida. For Part D, it's the same thing. Once you move from one state to another, you have 63 days in order to find a new Part D plan if you're not with a national carrier. Most carriers are national. And Marjorie, yes.
Who is my employer, known to all of you, I think.
No.
Or at least state of New Jersey. That I have from them, and a great big letter that says, our drug plan is better than any crappy federal drug plan.
Right.
And basically they give you a letter of
Yeah.
exemptions. But the advice, good advice I got from them, and I think it's probably advice Rhonda would give, is that 3 months, they said 3 or 4 months, before you turn 65, no matter what the hell you're doing,
Right,
apply for Medicare Part A.
exactly.
Because it costs nothing, and it puts you in the pipeline.
Yes.
And from then on, anything you need to do with Part B or Part D, or starting your Social Security, or anything else,
Absolutely.
becomes instantly easier,
Yes.
because now they have you in the old people pipeline,
Yeah.
and it costs nothing to do.
Exactly. And that's exactly what, if I'm sitting one-on-one with somebody, that's exactly what I tell them. 90% of the time I tell them this. But it's something that, once again, I try to feel somebody out first before I get, but Marjorie's exactly right. I've said that to every except for one, every single one of my clients.
Yeah,
Apply,
basically.
yeah, you get
Awesome.
Part A for free if you've worked 10 years or 40 quarters. Most of us have, probably, and not you.
Or
Not
you
you
have
too.
been married to anyone
Yes,
who
or-
worked 10 years
or
or 40
40
quarters, even if you haven't seen them in 30 years.
Right. And maybe you don't want to see them, just saying.
Now, that's all you need. You may then have to, if you, by the way, are doing it based on your spouse, you have your spouse's social security.
Right, you
number
need the
before
spouse's
you-
social security number.
Otherwise, you're gonna be working on it.
And that's usually a conversation I have one-on-one with somebody.
That's,
Do you
that's,
have a
those are the
question,
secrets.
Deborah?
Maybe.
Okay.
First of all, I completely rebel against the old people pipeline thing. I just really hate being in that, but
Hey, join the club, sister.
it's so not in my head. But here's the thing. If you are forced, like, I am not 65 yet, and I may be prematurely forced onto Social Security disability. So now, do all the same rules apply to, I mean, I know about the 20-month wait period and all that. But all of this that you're giving now, does this only apply at 65 or?
No, basically, this all applies, and the question was,
Because I missed all the beginning, so I'll have to catch up anyway.
somebody may be going on to Social Security disability, she is aware of the 24-month wait. Does this apply? Basically, yes.
Okay.
If you're under 65, there's only one supplement you can get right now in the state of New Jersey. But if you are on Social Security and not necessarily on Social Security disability, as soon as after that 24 months, they will automatically send you your A and B card.
Okay.
Yeah, they'll send you your Medicare card in the mail. And are you all aware that the Medicare has changed its numbering structure, and they no longer use your social, they use a different set of numbers, and I'm assuming that anybody close to the edge is aware of that at this point. Yes.
I just have one question again. What's the 24-month waiting period.
That's to make sure that your disability is really a disability.
Oh, okay, that's only for disability.
Yeah, I mean, because there's short-term disability.
Right.
You could be this pregnancy, you go out on a maternity leave, that's considered short-term disability.
Okay.
With a straight, normal delivery, yes, Denise.
Denise, if something is Part A free, why sign up for it? Why is it so mandatory?
Because it's not.
It's not,
It's just that your life will be so much
easier,
easier.
yeah.
I mean, basically, that's.
Yeah,
And I'm still.
it's only free because you work 10 years or 40 quarters.
I see.
It's hospitalization.
It's hospitalization,
That it helps with.
yes. So it will cover your hospitalization, and then if you're still working for a large company,
Yes.
they're gonna cover everything else.
Right.
But if you are working for someone like me, let's say, and it's just me and one other person, so there's two of us, then you would have to enroll in A and B, because Medicare becomes primary and you pick up a supplement. Now, for individual, let's say, this is a whole other ball of wax I really didn't want to get into, but if you had an individual plan, it's just you worked for yourself, so you had an individual plan, and you got it from, I don't know, AmeriHealth or something. Just before you turn 65, they'll send you a letter that says, you're turning 65, you no longer qualify for individual insurance, they want you out of there and on Medicare, because your premium, and you will know it, will be really expensive. So you want to get out of there too, because you want to try to save yourself a couple of dollars every month in what you're paying.
And also, I'm still working for a large company, and I'm understanding I don't have to mandatorily apply for the Part D.
Part B.
Well, the drugs.
No, okay, well, no,
Depends.
you would only have to apply for Part D coverage if the coverage your employer offers is deemed not creditable according to the Center for Medicare and Medicaid Services, CMS. Every year, your company should be notifying you by letter, and every employer, our coverage is deemed creditable, our coverage is not deemed creditable. And they, most of the time, if you work for a large company, your coverage is deemed creditable. If you have an HSA in that company, health savings account, that is not creditable, so you would have to take Part D coverage.
Thank you.
You would no longer be able to contribute to your HSA when you turn 65, so you're in a different ballgame altogether. Yes, Mark.
I have a question for you, Rob, because you're experienced.
Oh, gosh, here she is. She's gonna do me in now.
No, it's, for example,
Mhm.
my medical benefits come from the state of New
Mhm.
Jersey. And $46.10, there's a story.
Mhm.
It covers part of my Part D.
Yeah.
Is that the state of New Jersey, because I had 25 years of credited
Mhm.
employment, there's a bunch of different jobs in the state that qualify, will pay for a Medicare Advantage or Medicare
Mhm.
Supplement, or you can get a fancier one and you pay extra and so forth.
Right.
But they will not do any of that unless you're enrolled in Medicare.
Correct.
And I wondered if that is across the board
That's the way.
view of large companies that provide, or union
Yes,
plans often provide.
Yeah, usually that's the way things are going now. Sharon and I were talking about this earlier a little bit.
Speaking
That's
of-
the way, yes, that's the way things are going now. They're gonna require you to enroll, and I'll even take it a
Prove
step
before
further.
you can-
Yeah. You work for the state of New Jersey, and let's say you are married and your husband is covered under your benefits, and unfortunately you predecease him, he will get a letter that says, sorry for your loss, but come May 1st, you're out of the state of New Jersey benefits, you're on your own. This is the way things are going now, that in previous years, they would continue to cover that spouse until the spouse died. No, once the former employee passes away, they want the spouse out there, and that's true for the state of New Jersey.
Well,
as well.
typically, yeah, what the state of New Jersey does, I have to know what they do, is 25 years of, let's call it time credits,
Mhm.
because you could be in 6 jobs in 25 years. What matters is what the benefit
Benefits what-
package is at the day you put in 25 years of service, not when you retire. So I, for example, retired 10 years long after I 45 years of service. So I got the benefit package at the time I put in 25 years of service. If I had retired, some of you might know, for example, Joe DeStable, Susan Tiller. They retired when they got 100% of everything, no matter what the hell happened.
Right.
I retired at a point at which the state paid this Part B benefit, which was at that time $46.10. So therefore, every year, every month, I get $46.10 from the state.
Right.
But someone who retires with 25 years now,
Oh, yeah.
working, they're going to have to actually pay for part of this.
Right.
And
that's
I
the way
think this
things
is
are
probably
going.
typically.
Yeah, that's the way things are
The
going.
good news
Yeah.
is old people eventually die, so you don't have to pay forever, but they're phasing everything out. So it
Yes.
probably matters no matter who you're retiring from, or whatever, if they're a generous
Yes.
employer or union. That's the other thing, people.
Yeah, and it's going where everybody's trying to cut costs, and they're thinking of ways to cut costs, and retirement benefits are very expensive, and people are living to 197. So, I mean, it's all fine and wonderful, but this is true,
If I can brush my own teeth, I'll live to 100.
you know, and, so, you know, they're looking to, any way they can to reduce that cost, that's what they're doing.
I have a question about.
And tell me your name,
Oh,
please.
I'm Karen.
Karen.
About the Medicare supplemental plans.
Mhm.
Let's say at age 65, you're very healthy, so you take a plan that has a very low cost. But then down the line, you want to switch
Mhm.
to a more expensive supplemental plan. Do you have to go through that medical underwriting?
Yes,
You do?
yes,
Okay,
yes. They're gonna, even if you're switching within the same company,
right.
they used to automatically do it, and now they're requiring us as the agents to submit new applications
Okay.
and have it looked at.
Anytime you do a new supplemental
Yes,
plan?
yes.
Okay.
And I mean, the only thing that separates one plan from the other is cost.
Mhm.
And, you know, some people buy costs, and there's one company out there that's really cheap, but it's also a pain in the neck to work for. And so I will flat out tell you, if I was sitting in front of you, don't go with them. You know, I understand you want to save money, but if you're calling them every month and they're not pulling your money, and, you know, you have automatic withdrawal from your checking account and they're not pulling the money properly, and you're on the verge of terminating you every month, then why are you, it's not worth the extra $20 that you're saving, because you're spending $20 worth of time on the phone, you know, trying to get your business taken care of. That's ridiculous. So, you know, you don't always go with the cheapest. And just Ms. Sherman, it does tend to go up a little bit each year as you get older.
Just to piggyback on her question, so if you are healthy but you want to hedge your bets for the future, do you purchase a more expensive supplemental plan to start out with, so you think you'll be covered when you're older, or how do you figure that out?
Basically, the plans cover a lot of the same thing. So you figure it out by what's best for you. And for me, it's a consultative process. We'd sit down, we talk, we discuss. I don't flat out give anybody I don't say, you enroll in this plan. I would say, you know, think of this, you have this and this is your option. And what do you want to do? And let's do the numbers and let's figure it out, because, you know, so there's some, you know, we'd sit and we talk.
Because you mentioned something under, you know, you evaluated again, so if you had a condition that they said, sorry,
Yeah.
then you're stuck.
Yeah, and the plans, the most popular plans are not that far off the spectrum of themselves, where you would be stuck with lots and lots of out-of-pocket expenses.
Okay.
Yes, Lauren.
Bear in mind, as you retire, I'm retired, the state of New Jersey in particular is going to subsidize some of this in an
Yes.
odd way. And that is that a whole lot of your income is not taxable in New Jersey.
Right.
Social Security is not taxable. If you have a pension annuity, depending on how much it is, you may be able to subtract as much as $30,000 or $40,000 of it from your taxable income. It's called pension inclusion. This means that your actual taxable income is small. In New Jersey, you can deduct your medical expenses if they're only 2% of your income, so they have smaller income. And a whole lot of stuff counts
Yeah,
in
and
medical
that's
expenses.
accounting that I don't get into because that's accounting.
But, for example, if you buy long-term care
Right.
insurance, something you might talk to Rhonda about, this
Yeah.
is a good idea. That counts as a medical expense, the premium. If you buy health insurance, if your medical supplement plan,
Right.
all of that are medical expenses for purposes of tax deduction.
Yeah.
So some of these things, you think, oh my God, it's all this money, but in fact, it may end up being partially effectively subsidized by things like your taxes. So consider that when you talk to a Rhonda or you talk to your tax
Yeah.
accountant.
And that was all on the tax accountant, because I don't get involved in that too much.
No, and I'm
Yeah,
not surprised, but I would be surprised if you don't occasionally recommend to someone that they might want to share their concerns.
Oh,
with their tax
absolutely,
person.
absolutely.
For those of us that got a few years before we retire, is there anything that you would suggest we do to prepare or to be in a better position or stay healthy?
Bible.
Especially for, following up on the question that Bertha asked, I talk to a lot of people. The trend these days is, and you're gonna start to get a lot of business because corporate America is no longer
No,
providing
they're not.
retirement benefits.
You know what, I think the biggest
It
thing,
doesn't matter whether you work 15 to 20 years.
absolutely. I think and Sharon was sharing something similar to that with me before the meeting. The thing that people can do is research and my friend said, well,
My roommate says, yeah, I know.
And I said, well, your friend is a little misguided. You don't want to say your friend is wrong. Sometimes, depending on how tired I am, your friend's wrong, okay. And then they come back to you, you're right, why wouldn't I be right? This is my business, of course I'm right. You're not lying, of course I'm not lying. There's 7 million people out there that do what I do, why would I lie? Be as informed as possible, because Medicare is very daunting, and I've met people that don't even realize that, oh, I'm turning 65, I'm gonna continue, oh my goodness, no, people think that if they have Medicare, it's all taken care of. I hope I've burst that bubble for you today. I think that you just start doing a little research on it and find out, and just try to keep aware of the changes and stuff that's going on in Medicare. And we all try to keep as healthy as possible, and we're all, hopefully, we will live a long time, but it's insurance. So you have to think about, as I said earlier, are you gonna take a supplement and pay maybe $140 a month for that supplement? Or are you gonna, and know that if you go in the hospital, all your deductibles and things are handled for you, or you're gonna take an Advantage plan and maybe pay $70 a month, but know that you could be responsible for $3,500 or something when you come out of the hospital. That's just an example. It's, what you have to do your research, and you can't always listen to the ladies at church said, or my friend said, or I met somebody in the park,
Or
or
the
this
5-star reviews on Google.
Yeah, I know. I had a doctor call, one of my clients called me yesterday, said, Rhonda, I Googled something. I said, oh my God, you're a doctor. What would you do if one of your patients told you that you Googled? And he said, I wouldn't. I said, exactly. You do everything. Stay away from the Google, this plan got go to, and I say, the people on the phone are nice, but have an agent come, sit down, talk to you, go over it with you, ask the right questions. I represent more than one company. I work for you, I don't work for me, and that's every agent that's what I tell people all the time, I work for you. My goal is to steer you in the right direction so that I'll give you an example. I had somebody come to me, I don't want to pay anything, I want a 0 premium plan, and I flat out said to him, knowing your health history, no. And he said, why not no? And I said, and then we went over his health history, and I said, you need a supplement because you need the freedom to go anywhere you want to go, do what you want to do, and he had 3 hospital admissions last year.
Mhm.
And said to me, you were right, because I think if I paid a total of $100 out of pocket for all those hospital admissions, that was a lot of money, and you were right. I will also tell you that baby boomers are taking more of the supplements than the Advantage plans because they're sick of copays. They want the freedom to go wherever they want to go and do whatever they want to do without having to worry about networks, doctors, and hospitals, which is a switch with, some of my older clients, no, I like it. I don't want to have, fine, it's cool. So it's, it's a matter of personal preference, but it's also a consultative approach. What do you want? Tell me what you want. And like the client said, I want this Advantage plan. No, you don't. And that was one of the 4 or 5 times I've said that to somebody because their health history was such that, no, it's not the plan for you. However, I've had people switch from a supplement into an Advantage plan because they were sick of paying premiums for nothing.
Yeah.
So that would be my next question, is, because to be perfectly honest, I've already been down this road with my husband, but I obviously was not satisfied with the information we got, so here I am, but he did sign up for a supplement, because he also prematurely on Social Security disability, and he signed up for a supplement, we pay the copay every month, but he has the Medicare, and he also has veterans benefits, but
Oh, okay.
but for the prescription.
Yeah.
But honestly, we haven't had, over the year or 2 years that he's had it, we haven't had them pay like hardly anything compared to what we're paying them.
Right.
Is that normal?
Yes.
That's normal for the sub plans. So
That's
when
gonna
you're-
be normal for the sub plans, yeah,
That's
because
normal for
for most,
insurance.
that's
how
normal for insurance, yeah.
works.
But also, you could think, you think of it this way, like, hospital charges are usually the biggest part of an expense, and the idea is to stay out of the hospital. Myself, the last time I was in a hospital was when I gave birth 35 years ago. So yeah, that's kind of normal. If somebody, and this particular client of mine is kind of sick, so the Medicare Advantage plan would not be the thing for him. Yes, that can be normal. It's,
It just makes you wonder whether or not what are you covering if you're not paying anything?
well, and that's the way insurance rolls too, except that if you were paying individually for an insurance plan for your husband and yourself, it could probably range anywhere from $1,500 to $2,300 a month.
Definitely.
There you go.
I mean, my
So-
Cobra right now is $600 a month.
Right.
But it runs out in a year.
Yeah.
So I know that the cost is ridiculous. And even if you go on Marketplace, it's insane.
It is, because I
So
sell
how is that
more.
affordable? I'm like, well, this is something that they're making mandatory. How is
Yeah.
Marketplace affordable?
It's really, and I sell individual plans. It's daunting. The older you get, the more expensive it is. Any other questions before we shut it down, Mark? Oh, yeah.
So therefore, Denise, again, based on your questioning, you see all the commercials and everyone seems to be, and if you go to some other groups sponsored by Blue Cross Blue Shield, et cetera, they keep pushing this Medicare Advantage. So that may not be the real way to go. I'm understanding, and I understand your point, where you want to make the critical assessment in selecting a plan, but don't go too cheap because you may get sick and then you're stuck. But then you go supplements, you go Medicare Advantage, I mean, you don't know what to do.
No, you don't know what to do, and once again, it's a question of, if you call up somebody on a 1-800 number, their goal is to enroll you in their plan. All right, regardless. If you're sitting across from me, my goal is to find out what your needs are, and then we make a decision about what's the best situation for you. And so, and this is honest to God, I was referred by one of the insurance companies to a client in Irvington, and I go meet him, and he's really nice, and he's 40-something, and he sounded kind of young on the phone when I talked to him, and I'm like, well, do you have Medicare? He says, oh, yeah. So I go out, broke my heart because he was an amputee. He was missing a leg. He's a diabetic, he's missing a leg, he's 45 years old. And he had been talking, and this is I referenced this in my talk, he had been talking to somebody in California who was ready to enroll him in a plan that he was not eligible for. And I say this because this is where, you know, she was ready to put him in that plan, and I said to him, you can't get that plan. And we went all through it, and then once he read, so that's the difference between a consultative approach and somebody on a 1-800 number. You know, they're gonna say, okay, Denise, what do you want? How is your, you know, we sit down and we talk about it, and then we make a decision from there. You know, and very rarely do I say to somebody, you don't want that plan. You know, like I said with this client who had made some health issues, you don't want that plan. Because I knew that, you know, he needed to go wherever he goes. Now, getting to Michelle's point, she said, what happens if you move out of state? And I should have said this and I didn't, but let's say you do have a Medicare Advantage plan and you are covered by either Aetna or United, those, and I just use those because those are the two big national carriers, and you decide you're gonna spend 2 months in Florida because you do, you can pretty much find doctors in the area. You have to find doctors in the network in the area that either take Aetna or United, and you should be fine. With a supplement, you don't have to worry about that. So that's something else we talk about. If you were gonna say, well, you know what, I'm retired now, my sister lives in Florida, my brother lives in Arizona, my daughter lives in California, I'm gonna go, you know, so it's something that we talk about, what are your needs? And then I would say, Denise, you're gonna do all this traveling, honey bunny, maybe a supplement might be the thing for you. You know, maybe, I don't, you know, it's.
Do you review and be like, if we sit down and talk and we find out that maybe Bruce, my husband, can do better, can you transfer supplemental plans, like be
Yes.
in one?
You can, you might have to be medically underwritten in order to move from one supplement to another. The other thing is that, and I believe I said this during the presentation, that open enrollment is every October 15th through December 7th, so you can change the Medicare Advantage or Part D plans for January 1st effective date. I did say that.
Yes.
So, you know, that's something else, and when you're my client, I start reaching out to you in October.
Is that when you can switch without medical underwriting, or you should, that's only for Medicare Advantage?
That's only for Medicare
So
Advantage.
SUP is always medically underwritten?
Yeah, SUP after your initial is always medically underwritten. And I would and you can switch a SUP at any time. For Medicare Advantage and Part D, it's only during open enrollment. I would reach out to you. If I hadn't heard from you first, Karen, how are you? What's going on? What's happening? You know, you have any drug issues? And sometimes, no, people do have drug issues. You know, that, oh my goodness, I just got diagnosed with, I don't know, whatever. And I was thinking, I know, right? I just got diagnosed with Crohn's disease, and now the drug is costing me $1,000. Okay, Karen, we gotta talk now, you know, then that's, and usually when that happens, people reach out to me, so then I say, I'll call you in October, you know, so it's yeah, it's very consultative in that respect. Any more questions? Marjorie?
I would offer 2 observations. One is you deal with insurance all the time where your premiums exceed your likely claims. It's probably true of your catastrophic mortgage or house or renter's insurance. It is almost certainly true of your automobile insurance. The same decisions actually hold. So we think of, oh my God, health insurance, but in fact we deal with this all the time. And for the market to be stable, it has to be a forced insurance policy, whether you like it or not. The other one I would just say, because the question was, what do I do if I'm 40 or I'm 50 or I'm not retiring next week? What can you do? Well, of course, the simple answer is save,
Yes.
or buy gold. But the other one is there are certain things that are relatively inexpensive when you're young that you want when you're old, where it will become more expensive. One of those is long-term care
Yes.
insurance. So I would certainly look into it if you're younger,
Yeah,
because it's essentially, it's a savings device, but it's one that can pay
Yeah.
off, if you will.
and or if you work for a company that offers a group long-term care,
Absolutely,
you should
mine
definitely-
originally came from.
I missed
Yeah.
that.
So that I would suggest to people who are thinking longer term. But this is also true of things like term life.
yeah,
So you say, oh, somebody's gonna have to put me in a box and I don't wanna burden them with a cost. Buy a low cost from your bank term life, which simply means you have to die for
Yeah.
anybody.
casket, what is directcaskets.com? can
You know,
go
from the
home.
bank, often from your bank, you can get a
Yeah, no, we get a
relatively
low
small,
cost.
long-term life insurance policy for $1 a year or something. So if that is a concern.
Coming from the former economics professor, good advice. I just have something to say. I want to thank the AADC. I had a really nice time today. It was nice to see friendly faces and it's really been my pleasure. On every seat, there should be a small giveaway, my brochure, my business card. Please call if you have any questions. Thank you.
And Rhonda, on behalf of the AADC.
Oh my goodness, yes.
Thank you. This was awesome.
Thank you, thank you, thank
And
you.
I'm sure it's gonna be a part.
I love it, thank you.
Thank you so much, and I'm sure there's gonna be a part two for it. Workshop. And have a great day. and
Thank you.
Have a good summer.
Thank you.